Our next story comes from Dr. Merrilee Brown. Dr. Brown is a rural family doctor from Port Perry, Ontario, where she does office practice, emergency obstetrics, surgical assist, hospital inpatient work, and is a palliative care consultant. She's married to Steve Gray, the local clinic business manager, and a fair trade coffee entrepreneur. She's the proud mother of Alastair and Sophie, who have joined us today. She's an award-winning teacher in family medicine and has a passion for rural medicine education. Merrilee.
I title my story, Good Enough. It started innocently enough with headaches. My 4-year-old neighbor, David, was having headaches. Then he had blinding headaches, headaches that made him cry out in pain and sleep for over 20 hours a day. He was taken to see his family doctor. He went for blood tests. His family doctor couldn't find the cause of his headaches. He went to the pediatrician. He went for a CT scan, which we were told showed nothing. The pediatrician said the headaches and the sleeping were behavioral. David kept getting worse. Then he saw another pediatrician who ordered another CT scan. This one showed a baseball-sized tumor in his sinus cavity, rhabdomyosarcoma, 1 in a million. They asked the radiologist to look at the first CT scan again. Sure enough, the tumor was there, but in the sinus, not in the brain where the radiologist had expected. David went to the hospital for sick children. He had biopsies. His family met with the team. The tumor was inoperable. It was too close to the pituitary gland. They discussed the plan with the sick kids team. Radiation to shrink the tumor, then chemotherapy. The next year and a half passed in a haze of radiation treatments, consultations, blood tests, chemotherapy, hospitalizations, and medical appointments. There were good times, too. Lunches at McDonald's, camping, going to the cottage with friends, a trip to Disney World, Dairy Queen chocolate soft serve, and meeting Robert Munch. David accumulated bravery beads, a string of beads representing every blood test, procedure, radiation treatment, and chemotherapy injection. The really painful procedures had special beads. David's bravery beads were over 20 feet long, punctuated with lots of special beads. He discovered amazing talents. At age 5, he could swallow enormous pills. He had a maturity far beyond his years and was always concerned about the feelings of others, despite his own suffering. Through this journey, there were losses. David first lost his hair, then his teeth had to be removed as the chemotherapy slowly rotted them, causing him pain and frequent infections. He lost friends he had met in the hospital to their diseases. Eventually, as the tumor progressed, it pushed on the optic nerve and he lost his sight. For David, this was the worst loss. He really wanted to see color, and he told his mother so every day. Then it happened. Sick kids had no more treatment options to offer. The tumor continued to grow. David was tired of treatments that made him ill, tired of hospitals, tired of tests, tired of doctors. He and his parents decided that there would be no more tests, no more treatments. He would come home. Coming home meant that he would need someone to take care of him, a physician who could tend to his needs, help ease his pain, check in on him regularly. Since I was one of our small town's palliative care physicians and I lived 5 doors down the road from David, the job fell to me. I was terrified. I didn't know anything about pediatric palliative care. I was terrified that I wouldn't be up to the task. This was a child that I had known since he was born, a child that I loved. Sometimes we're called upon to do something that takes us beyond what we think we're capable of. beyond what we're trained to do, beyond our level of comfort. Taking care of David was my call. After all, there really wasn't anyone else to do it. I just hoped that I'd be good enough. So I started to go over to check on David and have tea with his parents. I drank a lot of tea over those first few months that I took care of David. I talked to lots of people, his caregivers at Sick Kids, his oncologist, the palliative care team, colleagues who were palliative care specialists, not regular family physicians like me. Sometimes their advice was really helpful. Sometimes it wasn't. So I muddled through the best I could, hoping that I would be good enough to help David. For a while, things went well. He had very little pain and went out every day to Dairy Queen for chocolate ice cream. Friends and families and neighbors and church members came to visit and drink tea. David had a lot of good days and a few bad days. At first, the tumor continued to grow and started to encroach on his airway. At first, it got better with some steroids to shrink the swelling, but the tumor kept growing. It started to make him short of breath. I talked to him and his parents about what to do when the tumor started to close off his airway. I talked to Sick Kids. I talked to my local palliative care team. I talked to anyone who would listen. Everyone agreed that to allow the tumor to block his airway would just be unacceptable. We decided to use midazolam, a medication that would make him unaware of the awful tumor impinging on his throat and hopefully give him peace. I had no experience doing this at home. I'd used a continuous midazolam pump in hospital when there were end-of-life symptoms that I could not control in other ways. But I knew what I was asking of David and his parents. I was asking his parents to take away David's ability to respond to them, to say that he loved them. I tried to arrange the midazolam in our local hospital, and I was told in no uncertain terms by the nursing administration that this would not happen. The nurses in hospital apparently were not trained to do this, like I was. Nevertheless, I'd made his parents a vow that I would do everything I could to allay David's suffering. So I talked to home care. Apparently, what was impossible in hospital because the nurses were not equipped to administer and monitor the drug was not a problem in the home with little or no nursing care or monitoring. So we started the midazolam, initially at a woefully inadequate dose, but slowly titrating up until he was finally at peace. 2 days later, in the arms of his mother and father, accompanied by his pastor reading the 23rd Psalm, his church elders and me, David died. His funeral later that week was a sea of orange. Orange was David's favorite color, his symbol of personal triumph over the cancer. So we all wore orange in honor of David's indomitable spirit, which could not be quelled by death. I still wear my orange shirt, purchased in honor of David. For me, it symbolizes something different, the spirit of muddling through, of being just good enough when called upon to go beyond what I felt I could do. Several years have passed since David died, and I still have tea with his parents from time to time. Reflecting back over that bittersweet time, I think that by muddling through, doing the best I could in a difficult situation, that I might have been just good enough. Thank you. I just wanted to say a word of thanks to my husband, Steve, who will wave, and my kids, Alistair and Sophie, who supported me during that time and came over on palliative care visits to play with David. And I want a special thank you to Linda Weilinga, David's mother, who's here today. If she could just wave. I want to thank her for the generosity of spirit to allow me to even send this in and for putting together the slides today. This morning, when I met Linda for coffee, she'd painted me a painting. Now, I don't know whether you can appreciate that from where you're sitting, but it's a picture of me holding David's head, caring for him. She's a talented artist in her own right and a wonderful person. Thank you. Thanks, Linda.
Thanks a million, Merrilee. If psychoanalyst Winnicott talked about the good enough mother, I think you just taught us about a physician good enough. Thank you.